Hey there, it's Dr. Justin Marchegiani. It's been a while, glad to be back. Today's video is going to be on natural birth control methods. I have lots of female patients that are inquiring about this. Also, their male counterparts, because they're trying to figure out ways that they can prevent pregnancy without having a whole bunch of synthetic hormones in their body. So we have the conventional approaches, which we'll talk about today, and then we'll also compare that to some of the natural approaches and figure out what works best for you, or at least give you the options so you can make a better decision. So let's dig in. Off the bat, we got three major methods we're going to talk about. We have the rhythm method, which is more timing based. We have barrier methods, which we'll talk about, include condoms, cervical caps, diaphragms, and IUDs. And we have chemical methods, which include birth control pills, whether they're synthetic estrogen or progesterone based. So we're going to go through those one by one. All right. So off the bat, we have the rhythm method. So first thing with the rhythm method is you have to know what your cycle is like. So off the bat, here's a typical female cycle. Make that a little bit cleaner here so you can see. A typical cycle is going to be about 28 days long on average. So if we draw this out 28 to 0, that gives you a good frame of reference. And we're going to use the red for the estrogen. So the first half of the cycle, you're going to see estrogen kind of pop up a bit, and then it drops off the last half of the cycle like so. Progesterone is going to be blue here, and you're going to see progesterone comes up right about here in the middle of the cycle and then falls off here at the end. So you can see here, first part of the cycle right here, this part here is going to be the follicular phase, put an F next to it, and this part over here will be the luteal phase. All right. Estrogen predominates in the first half, progesterone predominates in the second half. Really important. Now, ovulation, the prime area in which pregnancy can occur, is going to happen right here, right in the middle. This is the money right here. That's the money shot. All right. So that's where the sperm and the egg have to meet at the same time. That's going to be where that happens. So knowing that, what do we do based on that information? So if we have about a 2 to 3 day window here, so about 2 to 3 days here, and we know sperm can live about 5 days, 5 to 7 essentially. So we have a 5 to 7 plus 3 day window here. So essentially we got about 10 days, a month, a woman could potentially be fertile if sex happens beforehand, because if ovulation's already happened, it wouldn't matter if sperm came in here, because well, the hormonal timing is now past. But if we got sperm in here ahead of time, it could easily get in, fertilize that egg, and a baby would be on its way, so to speak. So just kind of keep that in mind. We had about 10 days of fertility a month, 10 days. And again, it really takes someone knowing their cycle. So I recommend a female having at least 6 cycles where they're within at least a day or two, so they kind of know where that ovulation is. Now, a couple things you can do to figure that out. There's a great app called Kindara on the iPhone. And the first thing you can do is you can track your temperatures in the morning. The first thing you're going to notice, number one, is a drop in temp. And the second thing you're going to know that you're already into ovulation is you're going to notice an increase in temp following the drop. So it's the drop first, the increase second, and this kind of means you're already in the middle of ovulation here. Okay, we're already ovulating here. And the last thing would be you'd also notice some cervical mucus. Kind of like an egg yolk kind of consistency. So those would be the 1, 2, and the 3 categories that you would use while you're in your cycle to kind of confirm that you're moving along the right direction. And you can also do a ovulation test, which measures luteinizing hormone. It's part of the brain signaling that increases progesterone, which is part of that increase in temp right there. Those are a couple ways you can do the rhythm method, and you just avoid sex during this time frame here to here. The big thing is you have to make sure you don't come in too soon after. So typically day 10 to day 20 or day 8 to 18 is pretty safe. And if you're on the fence, you can use a condom and or various barrier methods if you're within a day or two and you're kind of uncertain about it. Barrier methods, or I should say the rhythm method, works about 88% of the time. So just be very mindful. It's not perfect. If your cycle isn't consistent or you're more on the unhealthy side from a hormone perspective, you may want to look at combining a condom or a barrier method along with that. So that's the rhythm method there. Let's dig in and go to the barrier. So with the barrier methods, we have a couple standard ones here. You have your condom, which will protect you from STDs as well. Okay, that's kind of a female counterpart. That's a male counterpart right there. The others will be all female counterparts. There is a pill that they're using. It's not quite out yet, but it's decreasing FSH for men, which then creates spermatogenesis downstream. I'm not sure how I feel about that yet. Not enough data on it, but it's something that is coming out, the male version of the pill. So condoms are going to be the first one. Again, this will actually protect against STDs, which is good. The others won't. Okay, you're going to have your cervical cap / diaphragm. They're kind of similar. And that's just a barrier. Basically, it's blocking the cervix, where the sperm would come in from the cervix into the uterine lining or into the uterus. It basically caps that off and blocks it. So you have the cervical cap and the diaphragm. And the next you have the IUD. And the IUD basically sits in the uterus here and prevents the egg from implanting. That's how the IUD works. It has an effect of disrupting implantation of the egg. So the egg can't come in there and stick. So barriers, condoms, cervical cap, diaphragm, IUD. So a couple things here. This is going to be something the guy can use to participate in. Also protects the STDs there too. Cervical cap and diaphragm are great because they can be combined with the condoms. So you have a barrier method on the male side, a barrier method on the female side, which provides really good extra coverage. The only thing is you gotta put all these things in, right? You can't let these things sit. You gotta put them on before sexual intercourse or foreplay. So you gotta know to do that ahead of time. 1, 2, 3. The IUD is nice because it's always there, so you don't have to plan it ahead of time. The main one that we'd recommend would be the Paragard IUD. That's going to be a copper-based IUD. You have to worry about some copper issue with that, but I mean, it's not going to be the Merino, which is the progesterone, synthetic progesterone IUD. So it'll be a copper IUD, and that's always going to be there. Some women, it can create bleeding issues, so you got to figure out if it's right for you or not. You may want to try it, see if it works well from a symptomatic standpoint, but that's always going to be in there. So a lot of times you can do an IUD, you can combine it with condoms, or if you don't want to do the IUD because of side effects or you're worried about the copper issues, you can combine a barrier method with the condom method, and then you got a really good shot. And you can also just do the condom method, and that's still going to be good 90+% of the time. If you combine them, obviously you get even better coverage. That gives you the barrier method there, so you have the rhythm, and then again, you can use all these and combine them with the rhythm method during that 10-day time frame that you're hormonally sensitive for ovulation and for fertility and pregnancy. So these can be combined with the rhythm method. All right, let's dig into chemical. So with the chemical method, let's talk about the birth control pill. So the birth control pill in general works by inhibiting ovulation by decreasing feedback loops from the brain. So real quick, we have our brain. Okay, and we have from the brain, we have our hypothalamus and our pituitary. And that produces a compound down here. We have FSH on one side and LH on the other side. And that talks to the gonads. In this case, that's the ovaries. In males, it's the testes. So you have these various feedback loops here. And LH and FSH are really important. LH in a female helps to increase progesterone levels, which are responsible for cervical mucus. And FSH helps grow the follicle and also helps thicken the endometrial lining so the egg can implant. All right, and so does LH as well. So when we decrease these, when we decrease them by taking the birth control pill, it does a few things. It's going to increase more cervical mucus before ovulation, so it makes it harder for the egg to get in there. That's going to be the synthetic progesterones. And then the FSH is going to make the endometrial lining thinner. I think I may have said thicker. The endometrial lining will get thinner with the FSH being lower, and the cervical mucus will get thicker with the LH being lower. So synthetic progesterone will increase cervical mucus. The synthetic estrogen will actually thin out the uterine lining. So number one, harder for the egg to get into the uterus, number one. Number two, it will be harder for the egg to implant into the uterine lining because the lining will be thinner. Okay, that's the general idea of it. And for the most part, a woman's gonna be taking 21 days of pills. Typically, it may be a combo of estrogens and progesterones and synthetic ones. So not estrogen, but synthetic estrogens, and not progesterone, but synthetic progesterone. Maybe a combo. A lot of times it's gonna be a ethinyl estradiol, like a Yasmin kind of thing, or it may be a combo that has synthetic estrogen and progestins. Sometimes if there are side effects, they'll give women progestins throughout the month as well. Those have to be taken exactly at the exact time every day. Less flexibility with those than the regular ones. But again, 21 days typically of pills, followed by 7 days of reminder pills, which are basically just dummy pills. So your hormone levels can drop, because it's the drop in hormones that signals the uterine lining to shed and does it all again. So again, birth control pills, what's it doing? High amount of estrogen and progesterone. That high amount of estrogen and progesterone drops the LH and the FSH, okay? And when that's dropped, what happens is thicker cervical mucus cap. Sperm can't get up there. That's from the LH. And we have a thinner uterine lining from the FSH and the estrogens being high, which makes it hard for the egg to stick. Again, some of the side effects here, you're gonna have, well, I'm gonna do a whole other video probably in a few days on just the birth control pill. But issues with it is it can increase sex hormone binding globulin, which can actually decrease your testosterone level. So a common side effect is lower testosterone. So lower libido. It can also increase thyroid binding globulin, which can lower your free fraction of thyroid hormone, which can cause weight gain, right? Common side effects of the pill is what? Decreased energy, decreased libido, and weight gain. Big side effects there. Not to mention nutritional deficiencies ranging from B vitamins to folate to methylation to calcium, magnesium, and zinc. So there's a whole bunch of other things going on. So we always try to go with the most natural route possible. And I always try to suggest these things above, the barrier and rhythm methods, because, or in combo, because of their safety record. Again, the pill, not a fan of the synthetic hormones, just not a fan of it. I mean, the pill has been shown to help reduce uterine cancer and ovarian cancer and thyroid cancer, but it's been shown to increase breast cancer. And breast cancer is a far bigger killer than the first three. So you gotta keep that in mind. Plus we're bombarded with estrogens, synthetic estrogens in our environment all the time, and most females are in a constant state of testing with the various hormone tests we do. They're in a constant state of estrogen dominance, where their estrogen is so high in relationship to the natural estrogen progesterone balance, and they're predisposed to fibrocystic breast conditions, endometriosis, fibroids, ovarian cysts, mainly because of their hormones being out of balance. Now, a lot of people are being prescribed birth control pills off-label. So they're being prescribed it for hirsutism or hair issues on their face, or excessive bleeding, or migraine headaches, or mood issues, or PMS. And a lot of times the pill is not really getting to the root cause. So if our cycle is supposed to be like this, let me draw it out here so it's super clear. If your cycle is supposed to be like this, okay, here's your estrogen levels here, okay, and here's your progesterone here, okay. Now imagine this is a textbook cycle, right? This is textbook. Now let's draw this up here. Let's say it goes like this. Let's say your hormones will go like this, and they go high, and then they go low, and high, and low, and high, and low, and drop out soon. These perturbations, these up and down fluctuations are gonna create symptoms, mood issues, migraine, headaches. If it falls out early and you have a 5 to 7 day gap, this can drive PMS, back pain, cramping, breast tenderness, moodiness, depression. So again, is it really fixing the underlying issue? Because all it's doing is taking your estrogen and doing this. It's raising a flat line, then you hit your reminder pills, and then basically it goes right down. So you're just basically raising your estrogen level super, super high, and then you're taking your 7 days of reminder pills, and it drops. So all it's doing is, instead of these up and downs here, it's covering all the deficiencies up by giving you a flat line of hormones. So I hope that makes sense. Next video will be on the pill in depth. We'll go into the mechanisms, we'll break it all down like we did before here, kind of go into the nitty-gritty. But I hope anyone watching this that's kind of trying to figure out what's the best method for you, hopefully I drew out some of the pros and cons. Again, birth control pills been around for 50 years or so now. A lot of, some side effects there, pretty easy, easier than most above. So you got to figure out what works best for you, whether you'd rather have a little bit more inconvenience but less synthetic hormones, or a little more convenience for potential side effects. So you got to weigh it out, pros and cons. But if you're trying to deal with hormonal issues, PMS issues, and or get your hormones back on track, click on screen, reach out to myself so you can get more info on how you can get your hormones back in action. Again, this is Dr. J here. Click on screen, subscribe for more videos coming your way. Thanks a lot. Have a great night.